Welcome and thank you for watching. Today is Monday, March 9th. It's the end of the day. My name is David Siegel. If you know me, you know that I'm against alarmism. I don't think there's any reason to be alarmed about climate change, for example, but once in a while, something comes along that grows so quickly and can have such potentially catastrophic consequences that we have to pay attention to it. And we are in one of those times right now with the coronavirus. This is a rare black swan event that will unfold over the next 10 weeks or more. I spend most of my day learning about this and have been telling people about it for more than 2 weeks. We need to get a handle on it and take it very seriously. Today I'll give a short 20-minute overview of what we know, what we don't know, and what to do now. The first thing I believe is that a year from now, we mostly have recovered from this. This is mostly over. We'll be well along the way to vaccination and herd immunity, and the economic impact will have mostly subsided and will be in full recovery. It is going to get worse before it gets better. It could get much worse, but it is going to get better. It will end. Here's what we know as of today. Today we have 113,000 confirmed cases led by China, Italy, and South Korea. We see only a few hundred in the United States and many other countries, but those numbers will rise. We have 4,000 deaths now and total recovered. Now, the most important thing is that we don't know how many people actually have the disease. Confirmed means that they test positive, and possibly many times more people actually have the disease than have tested positive. So this number is not that meaningful. Could be many multiples of this. The United States has already screwed up testing, and so we are just reacting to what we know, and that is that the virus spreads rapidly. It spreads exponentially. Every person infects 2 to 6 people. Now, the fatality rate is very scary compared to something like the flu. It's probably around 2%. This is an impossible to know number that most likely is between 1 and 3%. But since we don't know how many people are infected, we can't figure out the mortality rate of this disease. But it's probably around 2%. Something like 15 to 20% of people who get it will be hospitalized. Almost all of those people over 65 years old. We do know that the Trump administration fired the U.S. pandemic response team in 2018 and further cut the budget of the CDC in preparedness. And we know that Seattle is the canary in the coal mine city to watch. Whatever's happening in Seattle may very well play out in many other cities around the world. It is unfortunately too late for contact tracing. They got the wrong test in the first couple of weeks. That was critical. They are ramping up slowly. It takes a long time to get the results. And we are not nearly caught up to several other countries like Singapore and South Korea on testing. So contact tracing, which is very useful for epidemiologists, is unlikely to be a useful tool, maybe in a few cities, but probably not in most. It's just too late for that. China is unfortunately effectively shut down. They've done a very good job containing the spread of the disease in China and in Singapore. This is what Wuhan, China, in the province of Hubei looks like. It's the same in Beijing. It's the same in Shanghai. As of March 2nd, which is already about a week ago, South Korea has performed over 100,000 and is probably closer to 150,000 tests now. And the United States dead last. So it's very important to try to track down possible clusters and contain them. And many places are doing a much better job than the United States. Now, we know that in Seattle, some hospitals are already overwhelmed and already experiencing shortages of critical supplies. So if you're sick, it's important to do the right thing. If you are sick in the next few weeks, you probably don't have the COVID-19, the coronavirus, you probably have the flu or the common cold. After about mid-April, you'll then be more likely to get the coronavirus. And in all cases, it's not a big deal. It's going to play out similar to a mild flu for most people. Now, if you're over 65 and have a risk factor, you really want to watch your symptoms, but very much for even older patients, it won't be dangerous. Now, on the other side, that 2% is dangerous, and we've seen at least one person in Seattle a few days ago went from no symptoms in the morning to death in the evening of the same day. So for those who are vulnerable, it's very serious. And the most important thing is that most of us will recover, and we should not go see a doctor. A doctor can only treat your symptoms, and not with very much. Doctors cannot treat against a virus. There's no reason to be in the doctor's office where they need to see other patients. And what do you do if your symptoms get worse? If you cough, it's going to be a cough and a fever, most likely. A runny nose, stuffy nose, and sneezes is less likely to be coronavirus, COVID-19. But if your cough worsens and you are starting to really feel like your cough is heading downhill and you're going to need help breathing, then call your doctor. I'm not a health official. This is my personal advice. Do not go to the doctor. Call your doctor and get instructions on where to go. If your bronchial symptoms head downhill and it looks like you won't be able to manage your cough, call your doctor immediately and get instructions what to do. They may want you to come in, but they may want you to go straight to a treatment facility. Okay, now this is what exponential growth looks like, and I want you to pay very close attention. This is a model, a computer program written by a friend of mine with 4.2 as the R0. That's the spread factor, the rate of infections that each person infects, and a period of 6 days, so almost a week, which is looking typical. It does look like it's doubling every 6 days or maybe tripling every 6 days, but here the model is for 4 or so. And you can see in the first couple, even after 3 weeks, it's 88,000 cases. But now watch, after 5 weeks, it's 1.5 million. And then in 6 weeks, it's 4 more million. It's 5 more million in 1 more week. 6 days later, we add 5 more million cases. Another 6 days later, and we add 21 million. I'm just getting started here. In 6 days, we had 21 million. That means another million hospitalized in those 6 days. And by week 8, a week later, it's 114 million cases. These are millions. It only takes 10 weeks to get to 2 billion. And in the following week after that, it's 8 billion. That's more than we have people on planet Earth. So it's not even going to matter if it burns itself out by May. We could have tremendous consequences. Now, this isn't the future. This isn't a prediction. This is just a computer model showing how exponential growth works, so that we appreciate that even if it's doubling every 12 days, the numbers get very large very quickly. Vaccines, what do we know? Several are in development. We don't know if they will be oral or if they will have to be delivered by an intramuscular vaccine shot. And if it's oral, that will make it easier and faster to deploy. This is not the year of the vaccine. It's going to take 12 to 18 months to get a vaccine developed, tested. One vaccine is in testing now. There may be others soon. That's just for a safety test, and then there's efficacy, and then there's dosage. So it will take probably through close to the summer to get the vaccine right. And by the way, there's a couple of different strains, and I don't think the strains matter. It is mutating, and you may have heard of a couple different mutations. It will probably mutate more, but my understanding is that doesn't change the protein shell that helps it deliver it to the lung cells, so that the same vaccine will work. That could change, but that's my understanding at the moment. 2020 is not the year of the vaccine. If we do have vaccine available, it will go to the critical needs patients. It will not go to most people. 2021 is the year when we have ramped up supply and distribution, and probably by the end of 2021, we will have herd immunity in most major cities. This is an effort that we probably couldn't have done 10 years ago, but now we are able to fast track. Fast track means that we will have substantial numbers of people covered with vaccine coverage next year. What we don't know, there are three main things we don't know. First of all, we don't know how it happens in summer. A pulmonologist yesterday told me that, this will be gone by May. Don't worry about it. Well, first of all, May is long enough to cause tremendous damage. But second of all, we don't know. It's not the flu. It's not just like any other flu. It's not really in a flu category. It might be defeated by hotter weather, by more moist conditions, so where it doesn't travel as far. But it might not. We just don't know. We've never been through it. And this is a novel virus, and so it's a big if. So if it is aerosolizing, and especially in colder weather, could it be carried by ventilation systems? We think probably that's not a worry. It may be technically it can, but practically, entire cruise ships, everybody would have it already. And we just don't think that this is a particular worry at the moment. That could change. But everybody I've spoken to now says that the main transmission methods are directly from someone else's cough, direct to your mouth, nose, or eyes, or picking it up with your hands, because it can stay viable for days or weeks as droplets on furniture, on railings, on car seats, on in airplanes, on tray tables, and so forth. That's how you're most likely to pick it up. So right now we're not worried too much about aerosolized transmission, and we don't know. We will not know we're at the peak until long after the peak has passed. You've seen how the numbers grow, and when you're at 1 million people affected, 1 million people have the virus, we have no idea if we're heading to 2 million or 3 million in the next week, or if we've peaked and now we'll be starting the downside. We won't know for weeks and weeks until it's passed, and as many viruses have a resurgence. They have a second season, usually. With the flu, it's in the next November, late autumn, but we won't know. And calling the peak is impossible until long after it's gone. Now let's prevent this disease before we get it. And how do we do that? Well, taking vitamin D probably won't help. Many studies have shown that if you are deficient in vitamin D, you should take vitamin D. And if you have a normal amount of vitamin D, supplementation, as with almost all supplementations, will not help your immune system. The same with zinc and vitamin C. Study after study after study shows that these are interesting hypotheses, but that the data does not support it. There's no evidence to indicate that either of these is preventative to any degree, maybe to some almost negligible degree, but not really to any measurable degree. What works is not getting the germs to your mouth, nose, and eyes. So that's washing your hands 6 to 8 times a day, using 70% alcohol to clean your hands. Carry a pair of gloves. I think cheap gloves is not a bad idea just to carry around in case you get on a bus or have to take public transportation or something, hold hand railings. But it's washing afterwards that really counts, and then not touching your face. This is a habit we all have. We all do it several times. I've done it during this recording several times. You want to use your sleeve. You want to use a tissue. Use anything but your fingers to touch your face. And finally, if you're healthy, isolation is a good idea. Don't go to conferences, don't go to concerts, don't go to events, don't fly, don't take that vacation. Stay home and isolate from other people so you don't get it. And then very importantly, families and businesses should make a plan. You're going to see some scenarios coming up, and you should make a plan. If one parent or one person gets sick, if an important person in a business gets sick, you should already have a plan. And the most important thing is to isolate that person. So I know it's very difficult for many families, but you should think about it. What will you do if various people get sick? Because we don't want more people, it could even be asymptomatic, running around town giving the virus to other people. So we really want to nip this in the bud and get as few people infected as possible. Make a plan now. If you want to see what some businesses, some companies are doing, there's a website tracking this. Stayinghome.club is tracking most of the Silicon Valley companies and what their policies are. Apple, I think, said that these are going to be seen as sick or vacation days, but I won't be surprised if in a month from now most companies announce that this is just a loss of business revenue and we're all just going to have to deal with it. There could be quite a bit of economic impact that I will maybe go into in another video, but not this one. And finally, very important, masks aren't going to help you keep from getting the disease. And if you have it, really, if you have it and you're out and about and you think a mask would help, you shouldn't be out and about. Maybe if you are coughing and you must go get groceries, although I don't see why you can't just order couscous or have it delivered. Honestly, you should not be outside. You should not touch a mask unless instructed to by a healthcare worker. There's really no reason to buy, hold, store, or use masks. Please reserve those. Let the healthcare workers get the masks. They need the masks and we don't, and it doesn't help anyway. How are we going to manage it? Sort of at the community level, we're going to close schools. As soon as we see signs that someone in the school has this virus, the schools are going to close. I'm imagining districts will close, and that somewhere between 1/3 and 2/3 of all schools will close over the next 6 weeks. This is my personal prediction. It may not happen. People may not come to work. That's not such a bad idea. We hope that healthcare workers will get the equipment they need and they will come to work. It's important to understand the basic equation of death here, which is that death equals the number of people who need ventilators to save their lives minus the number of available ventilators. Of course, most ventilators are made in China. Many of our drugs are made in China. So there are going to be not only knock-on effects because we don't have enough ventilators, but also because we don't have just enough beds so that when people are in the hospital, others who have car accidents or other chronic or acute conditions need to get to the hospital, there won't be any place in the hospital. We have one overwhelmed hospital in Seattle already. They are short on supplies already. Seattle, as an entire metro area, will probably run short of supplies within a couple of weeks. And that could start happening in many other cities. So the key thing to understand is ventilators are very expensive to manage. They're not that expensive to make, but to keep them clean, they require licenses. You're going to be on them for a while, and there's a lot of insurance issues. So ventilators are going to be a limiting factor, and beds are going to be the limiting factor. Let me take you now to my scenarios. These are my personal guesstimates of how things will play out. These are each an order of magnitude higher than the other, and each of them, the first one, have a 30% of chance happening. And the first one's pretty mild, a very mild flu season, tens of thousands hospitalized, thousands killed, elderly people who are frail and at risk anyway. And why do I give that 30%? Because it really might just disappear in May, just as the flu does. It might be very seasonal, and the hot weather and more humid weather may just end it. We hope. That would be fantastic. So because that is a real possibility, I give it 30%. Now, the next one is a medium flu, and that's hundreds of thousands of hospitalized. We have 1 million hospital beds in the United States, and at any one time, 200,000 or so can be made available. That's the kind of capacity we have to handle the flu, and more or less, some of those are already taken with flu patients, but we could see, it's certainly possible, and I give it 30% chance, that we have tens of thousands of killed. And again, that's less than a severe flu season. It's more or less equivalent to the flu season we have going now. These are people who are vulnerable. But number 3 is also, in my view, 30%, and that's a very bad flu. This is something a little bit less than the Spanish flu of 1918, which killed about 700,000 people in the United States and 40 to 60 million people worldwide. Low hundreds of thousands of dead. I'm sorry to report that we've heard about mass graves in Iran already. This is not a likely scenario. This is a 30% scenario, but it is tragic and it will cause tremendous economic damage, a recession that we likely won't recover from for quite a while. It depends a lot on what central bankers do. Central bankers have the power to prevent long-term recessions. They can encourage and stimulate long-run economic growth, but it is going to be very bad if we get that far. Now, 4 and 5 I'm not really going to talk about. They're possible, but very unlikely, I hope. One thing to understand from this chart is that once we are past scenario 1 and we are into scenario 2, scenario 1 is gone, and we'll have a new set of odds. We'll have to recalculate what the scenarios are from there. So this isn't anything to worry about 4 or 5 right now. Let's see if we can maybe get through just 1 and 2. But as soon as we're through 1, I'll have to recalculate. I'll make another video, and we'll look then at what we think the odds are. You can make your own calculations. These are my guesstimates. I have no idea what will happen. Certainly, whatever happens is what happens. Whatever, the odds, it's like, people getting elected who have low odds of getting elected. If it happens, it happens. So let's just try to keep handicapping it so that we understand that there is a reasonable chance of something very bad happening, and we should not be surprised. We should be prepared. All right, the new normal is wash your hands. This is probably forever. Wash your hands 6 to 8 times a day. Don't touch your face. Build good hygiene habits. Stay 6 feet away from others so that their saliva doesn't enter your bronchial tract directly or your bloodstream directly. Minimize your social interactions. For now, just cut it off as much as possible. I think it will be important to cancel the Olympics as soon as possible. Do I want that? No, I don't. But they shouldn't even be out they should be training, that's fine, but not meeting in big groups. We've got to cut down on any meeting of more than 50 people or so. Isolate yourself if you get sick. Do not go to the doctor if you get sick. But if you start to develop bronchial symptoms, a bad cough that looks like it's getting worse, call your doctor immediately. Don't fill your doctor's phone up with questions about what should I do. Call if your symptoms really get worse. It is not a time to panic. It is a time to be realistic and have a plan. Now, who should worry? Well, to some degree, of course, we should all worry, but the people who should worry most are people over 65 who have a risk factor. If you have a compromised immune system of any age, you should worry. And these are people who should try very hard to isolate themselves as much as they can. Those who could pass the virus to others, in case you happen to know that you pass viruses without much symptoms, or if you think you could, or you have a mild cough is a good reason to quarantine yourself, and you should be worried about that. If you get any symptoms, you're done. You're not going to power through it and go to the meeting or go to the conference anyway. And then economically vulnerable people, we saw trading halted today already at the stock exchanges. There will be many knock-on effects of this. It will last for months and months. All I can say is that we will all be going through this together. No one is, some people may be trying to profit from this, but most of us are just trying to get through it. And the central banks have a big role to play in stimulating the economy. And we should all play the same game. We should cooperate, share information, not panic, and help each other. Have a plan. Be prepared. There's a 30% chance that this is very bad. Stay up to date. Watch other people updating. They know more than I do. Look at doctors. Listen to people like Sanjay Gupta on CNN. And, the WHO is worth listening to, although there is some pretty serious corruption there. But get whatever news sources you can and stay up to date. My name is David Siegel. I help people with critical thinking and prioritization so they can focus on the big stuff and not sweat the small stuff. Please contact me. My goal is to help families, business people, and their families. So if you think I can add value to your life or what you're doing, or we can collaborate on something, and you think that you can see some good entrepreneurial ideas for helping people here, doing well by doing good and helping others pull through it, please contact me. I hope not to make another update, but I most likely will have to in about 2 weeks. Stay safe, take all the precautions, and I'll keep an eye out for any updates you can get. Take action early and be prepared. Thank you.